work in putting this meeting together. We so appreciate it.
Absolutely. So this is another part of our cultural series here at IU Health North Hospital in conjunction with Anne and her team. We are happy to have the members of our Sikh community join us today to help us with some of our cultural needs. If we want to go around and have our presenters introduce themselves. I do not, Sharif, I do not see you on camera, but I do see you here. If you do not want to be on camera, those that are attending, that's perfectly fine. You don't have to be on camera. Please do let me know if you have any questions. You can feel free to type those in the chat and I will navigate that for our panelists today. And also, please, just some housekeeping needs. This is a approved, we are approved providers of nursing continuing professional development by the Ohio Nurses Association, which is accredited by the American Nurses Credentialing Center Commission on accreditation, and also by the Indiana Social Worker, Marriage and Family Therapist, and Mental Health Counselor Board to provide Category 1 continuing education programs. Also, we are approved by the ILPA for the Indiana State Psychology Board and Indiana Behavioral Board to provide Category 1 continuing education. This panel today has been approved for 2 continuing education units for each of those. If you will all please text the number that is in the chat to get your credit and attendance for this. A survey will be sent out in approximately 2 weeks in order for you to obtain your credit hours. So let's start with KP. Would you like to introduce yourself?
Rebecca, that is fine. I've also have introductions for each of our members if that would be easier. So whatever is preferable.
Whatever you say, Rebecca. This is KP Singh. I am a member of the Sikh community and a representative of the Sikh Satsang of Indianapolis, which has been one of the oldest religious congregations of the Sikhs in Indiana and one of the largest. As my background, I'm an architect by training and city planner. I am a public servant. I write and I discuss, and I'm a member of the interfaith community here and in several other organizations. I have been here in Indiana for the past 53 years, and so have witnessed the change and the evolution of the Sikh community in Indiana from 1 or 2 back in 1967 to perhaps as many as 7,000 to 10,000 families in the state of Indiana, maybe 3,000 to 5,000 families in the metropolitan area itself. From no place of worship to several major places of worship that are called gurdwaras. There are at least 8 or 9 recognized gurdwaras in the central Indiana area right here. The largest concentration of the Sikhs then would be in the metropolitan area of Indianapolis, but there are also communities and congregations as well as Sikh temples in other places, Fort Wayne and Maryville, Evansville, and other places all across the state. One other thing that struck me when I came here was the fact that they hadn't seen a Sikh up close. The Sikhs, by their faith, tradition, as well as commandment, have to have their hair uncut, as well as to cover their hair in public with a turban, or a smaller turban, or the turban that you're looking at that I'm wearing. And so they had not seen up close, and so they thought in the afternoon paper that an alien has landed. And so I think this is really kind of a remarkable journey for Anne as well as Rebecca to really kind of organize this important event and activity that important events that caregivers, which is in the healthcare area, can get to know some of the do's and don'ts and some of the sensitivities that may be part of it. So I would be very happy to participate in that discussion going forward. I live in Indianapolis and I'm speaking from my home in Indianapolis. So all of you, and there are 24 of you that I see as the number, I commend you for showing interest. But this is something that I think we can no longer ignore, that people of different communities, whether they are Jain, Hindus, Sikhs, Buddhists, and others, ethnic communities that are new in this area, that are the pioneers in the state of Indiana, that they get to have the benefit and as well as the input with regard to the healthcare giving, healthcare facilities, as well as the healthcare services that the state of Indiana provides. So welcome and thank you for inviting me, Rebecca and Ann. Is that a good introduction? Would that do for the time being? Okay.
That was very nice. Thank you, KP. Maninder, would you like to introduce yourself?
Right. My name is Maninder Singh Walia. I am just going to be very brief because I call my father, Mr. KP Singh, as my father. So he has already introduced the congregation side, the faith side, that we belong to the same congregation, which is a Sikh Satsang of Indianapolis. And
stand in the other shoes, as my mom would say, just for a moment. Stand in their shoes.
Can you guys hear me okay?
Yes, I just muted some of our guests that joined us.
Okay, because there was a sound coming in. So basically, you know, as the Sikh population is growing in metropolitan area, and it's a great effort by your organization, by IU, that as more population grows, there certainly you will see a more Sikh patients coming into the hospital. And certainly, you know, you are concerned about the protocol, how to handle a patient when they come in, their families, and we can go over all the details, what we know, that how should they be treated. Just to summarize a little bit, we can go over the background and introduction of the Sikh faith. We can slightly touch that up. Also the religious beliefs, culture, celebrations, and their practice. Individual practice may vary, which you will see. Then their medical and nursing care, and all their diets, food preferences, and you know, very important, what are the rituals when the life ends, end of the life care. So we can go all over all that, and I think this is just a brief introduction. As we progress in the meeting, we will be moving forward. Thank you so much for doing this event. This means a lot to us. Thank you.
Thank you very much. We are just so blessed to have you guys. We also have Sharif, if you'd like to introduce yourself. It's now showing she's offline. I'm not sure if there are possibly some technical issues on her side, but we can.
Okay, I'm sorry. I had muted myself because my fur baby just entered in, so I wasn't sure he's gonna bark. Okay.
There she is.
Can you hear me now?
Yes, we can.
Okay. I know you're struggling to say my name, which is Chulji Kaur Obroy. I'm also known as CJ. So if it's easier for you, just call me CJ. I will be very brief. I had sent my introduction, but here it is. I work for the Department of Local Government Finance for the state of Indiana. I had immigrated from India about 23 years back, and Indiana has been my second home since then. Both my children, I have two kids, they were born and brought up here, and they are currently studying at Purdue. I have been also a member of the Sikh Satsang for 23 years, and for the past 3 years have been engaged in some volunteer activities for the Sikh Satsang, for the Center of Interfaith Cooperation, and also for the Nationalities Council of Indiana. Currently, I'm serving as a board member for the Sikh Satsang. Uh, the cultural part, I have worked with the courts and hospitals as an interpreter for Punjabi and Hindi language, and I have helped the patients and the doctors kind of work between them. So not only just translate the language, but also being liaison between the two. So that has given me some idea of how you struggle with understanding the culture and the religion as well. So yeah, like Marinder Virji said, I call him like a big brother, so which is Virji. So like he said and KP Uncle said, um, we are ready to get the questions and then we can go over the material as we progress. Over to you.
Wonderful. Thank you so much. And thank you for clarifying the pronunciation of your name. I appreciate that. So KP, would you like to give us, I know you had, when we discussed last week, you had some additional background information. Would you like to start off by telling us a little bit more?
I think all my friends that are already in the class right now, some of them probably have already some colleagues and friends and neighbors that they might have met a Sikh, Sikh young boy, Sikh man with a turban, or a Sikh lady, the lady of the house, or they might have met some that are in the elderly category, the grandfathers and fathers and grandfathers and so on in their neighborhoods. But it will be still important for others who have not had a close contact with them to know just a little bit, as Maninder said, and Chirjeev also pointed out, that we start from there so that the questions then would become much more relevant if we just go with a little bit of basic information. Sikh faith is the youngest faith among major faiths in the world, fifth largest. It originated not in Arab countries. Sikhs are not Muslims. It originated in India. Sikh faith is a distinct faith, with its own philosophy, precepts, traditions, and of course, sacred articles of faith, as well as its own scriptures. And so it will be important to really, for those who are going to provide care, or in some capacity, or counseling in some capacity, or maybe surgery in some capacity, it's important to know that there are certain symbols you are going to come across as Sikh person, whether it's a male or a female, and sometimes even a child. And so let's just start with that as a thought, that you need to be aware of it. Sikhs are ordained, commanded by their founders to wear several symbols. One of them is I don't know if you can see it or not, is a steel bracelet. Can you see anything here? I don't know if the image is showing any of this or not. Do you know?
You will have to share.
Can you see the image of me holding a steel bracelet?
You can put it back by your face and we'll be able to see it.
Is this better?
Yes,
right.
Perfect.
It's a steel bracelet, and it changes in size as you grow, because you can wear the same size you wore when you were two days old. So it will change in size. It's a strictly steel bracelet symbolizing the continuity of all life, oneness of all humanity, no end, no beginning, as well as the metal steel that always have your heart of steel and yet your sense of humility at the same time. So there's a steel bracelet. You will see it on their right hand, generally on their right hand, and they will have it whether they are a patient or whether they visit the hospital. So this is the first important symbol. These are commanded by the faith. The second symbol is a comb. That is a wooden comb, because the hair is uncut, so it must be always groomed and always cleaned, of course. So there is a symbol. Second symbol is the comb, not symbolizing just to really clean your hair or just to really have your hair combed, but a symbol of cleanliness of the spirit, cleanliness of the body, cleanliness of the mind. So there's that symbol. The third symbol that everybody doesn't wear it, but some of the Orthodox people would, baptized people would always have it, and that is a kirpan, a small kirpan that is worn with a sash across, going from right to left towards the hip. symbol that they will have it. It's not a weapon, but it really symbolizes the right to bear arms, so to speak, to protect your honor and the honor of a person. Naturally, when they are in the hospital, you want to make sure that this is in a safe place and not on that person, regardless of the illness of the person or surgery of the person or whatever the condition he is in the hospital for. But he will have that as one of the symbols with him. Most of them would have it. And so that is important to really take possession of it at that point and perhaps keep it in a very safe and a place with a great deal of respect. It's not a weapon. It's not a knife. It's not this. It is a symbol of your right to protect and to preserve the honor of not only yourself, but of others who may be in jeopardy. So Sikhs are famous for that, where they stood up for other faiths and other cultures in hours of difficulty. If you're going to have your hair uncut, it is mandated that you cover your hair. You can do it with a small scarf. If you enter a Sikh temple, they'll give you a small scarf to cover your head, or you can bring your own scarf. And so that is important to know, that covering the hair, uncut hair and your head is an important part of going to worship in any Sikh temple or place. So he would like to have, a patient would like to have his head covered when you ask him to, okay, please remove your turban because we got to do an x-ray of your head or a surgery or whatever the case might be. So that's important to know, that he would have his head covered, and you are not to just forcibly remove this. You have to request him with a great deal of dignity and respect to, please, we need to really look underneath the skin as for any laceration or whatever the case might be. So he would have the head covered. If he prefers to have a slightly larger turban, but not as large as Maninder is wearing or I am wearing, then there is it's called patka. So at night or during the day, when nurses are coming in, doctors are coming in, most of those sick patients would like to have their heads covered. So there is a in-between size between the turban and the small scarf I showed you a minute ago. The other symbol of the faith is important, and that is when we are talking about uncut hair, that means on every part of the body. That is that a Sikh, according to the commandment of the faith, and that wouldn't necessarily apply to all patients. Some of them keep and some of them don't. But it would be a mandate of the faith to have their hair uncut any place. So if you're going to have maybe a vaccine, I mean, you're going to have an injection or you're going to take some blood or whatever, you may want to really shave some hair. No. Ask that person if that's okay. Ask the family if the person cannot speak himself. And so that's an important part to really remind, not the hair, just the turban and the beard or the hair on your head, but no part of the hair in his body is to be touched without his consent, without respect, without involving the family there in that case. The fifth symbol of the faith then is a underwear which symbolizes chastity, symbolizes the honesty and your loyalty to one partner. All people don't necessarily wear that same style, but some of them would have the original style that was recommended by the faith. So symbols are important, because I think if you're going to really treat a patient, and I know that the IU is perhaps one of the most leading places for providing healthcare to and research on healthcare matters, it is important to really develop that sensitivity, that understanding the basic information that is very, very critical. As Maninder mentioned about circumstances of death, circumstances of illness of one kind or another, or if it is a female patient, maybe Charji will talk more about it, that they might prefer the same gender nurse, same gender doctor, same gender surgeon, if possible. We'll go into the detail as the questions emerge. So the faith, but they are not taken as just simply as symbols, but they are to be taken as sacred articles that have to do with his persona, with his health, with his mental state, with his ability to really have the basic tenets of the faith respected by the nurses, by the doctors in a hospital where he's a patient. Now, most of the families would prefer, and most of the families would very much really are oriented to this, and that is some kind of a prayer book, which is the morning prayer, afternoon prayer, and other things that are in there. And so they would like that to be recited to them, morning prayer or evening prayer or in between daytime prayers. And so that is just a simple book. It's a simple, you could say, a small book, which has the designated prayers that the patient may like to have it either recited, or if he's in a much better state, he may like to do it himself. That again is something very sacred. It is not just like we have Bibles in every hotel. This is something we consider as very sacred, and so that is an important part of his ritual as a patient, as a when he's at home or when he's in good health. So these are some things that there are close to 35 million people, as I said, and close to 1 million Sikhs in America. As Maninder mentioned, that they are more and more in that stage where they are going to the hospital for different things, and so you will be encountering them. I have been to Methodist and other hospitals here on occasions when they needed an interpreter, as Chirji mentioned also. And so that you can communicate, this is what the doctor is saying, and this is what the patient or his advocate is saying, because that person didn't speak any English either. And so that is important to have those advocates available in your communities where you might encounter such a patient. In other words, that don't wait for the patient to come in. If you are in Lagooty, Indiana, or if you are in Terre Haute, or wherever some of you might be, that you need to have that little information on hand, a resource on hand that you can tap. We have a Sikh patient, or we have a Sikh woman that doesn't speak any English. So in other words, the healthcare is no longer, okay, here is a patient and here, let's do the procedure. In the case of many new communities that have really now part of Indiana, we have to address ourselves to those additional areas, along with all the details that are coming about the healthcare itself, that we recognize the cultural part of it, the spiritual part of it, the physical part of it, and the emotional part of it, all as an important way of providing service.
KP, I believe there was a problem with the system. Are you able to turn your camera back on?
My camera I can see myself. My camera is not on?
No. Can you turn it off and then turn it back on again? I don't know if I know we talked before that.
They said they can't see the camera.
We
Hang up?
No, unplug and plug it back in. I'm not sure. No, open the door. Open the door where it's plugged in. Not there.
Here?
No.
Here?
Where it's plugged in. Where the camera is plugged in.
Where the camera is? Where is the camera?
By the down on the desk, under the desk, under.
I don't know what you're talking about, Rob.
Can you turn it off? Like just turn your camera off first and then turn it back
Where is
on?
the symbol for the camera? I don't know.
CJ, we are unable to hear you. If you can speak up a little bit.
Oh, camera.
Well, go to Maninder and talk to him for a minute as we figure out what's going on here.
Okay, we will do that. I'm going to hit mute on your microphone for right now as well.
Okay.
Would you like to pick up some of the conversation?
Yeah, certainly I can do that. I think Mr. KP Singh already went through the religious side of the Sikhs, which he mentioned about the religious beliefs, the fundamental beliefs, the uncut hair, wooden comb, steel bracelet, short sword, and a type of underwear. And he mentioned all that, and also the headdresses for the male turban and female scarf. So these are, these things certainly. These are the religious significances of the entire situation. When you see a Sikh person walking in, patient coming in, you're gonna see all these things. And he also touched about the little bit the while the bedside, how do you treat them? Basically, they're doing their morning prayers or evening prayers with the uh, small version of the book they have, which is the holy small version of the books. And also, sometime you're gonna run into a situation where if the patient is sick, they certainly like to see their holy music, which is can't be that loud. I mean, they can always chanting inside. They certainly like to see that small music going on in the back. I mean, you're gonna run into that kind of situation. So just 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 be aware of that. And also the pretty much as we go right along, the general beliefs and the practices of the individuals may vary, which Mr. KP Singh already mentioned about their dietary situations, as well as some Sikh patients have hair, and when you operating or giving them any anesthesia or injection, that please ask them whether they like to their hairs shaved, or in that situation. Emergency situations are different. That that's the time of the need that can be done. But certainly these questions they need to be addressed. Um, Again, I will add to this thing that sanctity of life is an injunction. Human life is the of the highest form. Just the individual, general beliefs and practices. And according to some doctors, which I mentioned yesterday, day before yesterday when we were testing this thing, there's already a protocol form has been developed in Chicago area. So I was a little bit a part of that whole thing, but there were Sikh doctors were involved. So just I'm going to read a few lines that what they have put this in the form. The heading says general beliefs and practices. So the blood transfusions are allowed, assisted suicide are not encouraged, maintaining a terminal patient on an artificial life support for a prolonged period in a vegetative state is not encouraged, but that can be discussed with the family. Organ transplantation, both donating and receiving is allowed. Autopsy is permitted. Artificial reproductive technology is permitted only during the span of an intact marriage between husband and wife. Genetic engineering to cure a disease is acceptable. To date, Sikhs are opposed to human cloning. Abortion is not advised except for medical indications. Male infants are not circumcised. So they're just basically, going a little bit deep into the medical side. Also, an essential aspect of the healthcare is the healthcare provider roles in understanding the concerns of the patients and the family and communicating these concerns to all those involved in the decision-making process. To console and comfort the patient and his or her family so that they can accept their or their loved one's disease state, and if possible, to take care of the family's needs beyond the medical aspects. So I can go more in the detail, but just important aspects of in care of Sikh patients include respect, modesty, and privacy, such as knock the door, announce your arrival, etc. Do not interrupt a praying patient for routine care. Respect the patient's personal space by limiting unnecessary touching. Be sensitive to the significance of the Sikhs 5Ks, which Mr. KP Singh already mentioned, that the religious side, those are the religious symbols of articles of faith, which they may choose to wear on their person at all times. Again, they are uncut hair, wooden comb, steel bracelet, underwear, and a ceremonial sword. So I can go on and on. I think I will certainly give some time to my sister here, Chirjeev, that she can certainly shed some more light. So I will yield for now.
Thank you.
Yeah, sure.
Sure. Thank you for going over the information which Illinois has already adopted. Someone in the chat box asked if we can share that information because there were a lot of details in it. Certainly, I believe Becca can do that. I will go over briefly when I have been to the hospitals and have been asked this question if the patients can pray in their own room. And there is, and the doctors and the staff were concerned and provide them a separate room, which some of the hospitals have. And one thing which I would like to bring up is that the patients can certainly, which has been explained, that they can take a small version of the Holy Book and read their prayers in their room as long as it's clean. Oh, you cannot hear me?
Yes. Can you turn up your microphone? It's very difficult to hear you.
Okay, how about now? Is it
Much
better?
Much better.
Okay. Sorry about that. I was quite low. So for the prayer room, it's basically they can, okay. Basically, they can pray in their own room with a smaller version of the Holy Book, as long as the room is quiet and and prayers can be done any time of the day. But if there is a room provided to them, then it should be clean. There should be it shouldn't be crowded, and it should be carpeted because we do not wear shoes when we are inside our it's called a divan hall, or it's a prayer room. So basically just being sensitive to the needs, if a room can be provided, I'm sure it's for other religions too, and it can be shared by people. It's not like it has to be a Sikh prayer room specifically. So other than that, on the diet and food preferences, Sikhs who are baptized, I believe they wouldn't eat the non-vegetarian food. So you maybe will have to be sensitive to their dietary preferences, and it all depends upon where that person is in the wide spectrum of choices. Some may be okay with eating non-vegetarian food, but the restriction to that, which is in Sikhism and a big no-no, is the halal meat or the zabiha, which is okay for other religion, for Islam or Muslims to eat, but Sikhs do not eat that meat if they are non-vegetarians. So it would be basically their own individual preferences over there. But the baptized Sikhs who are initiated, they wouldn't touch the meat at all. So a vegetarian food would be their first choice. Do you have any questions so far?
I do not have any that have been typed in, but I'm making a list as of now.
Oh, okay. I am not sure if KP Uncle is ready to jump in.
I hope that you can hear me. I don't exactly know this technology, and both Maninder and Chirjeev are really far away from where I am to guide me through this. But can you hear me, Rebecca?
Absolutely, not a problem. We can hear you.
Okay, good. I think that Maninder really went through a whole list of things, and also Chirjeev added a great deal of additional information about the diet. The diet may be something that we have to really put another dimension to that, and that is if the patient is not enormously sick, and if it is acceptable to the attending physician and the doctors, then perhaps, as was done for at least the family members who were really visiting with these patients in the hospital, that maybe some food could be brought in, as long as it is prepared in a certified kitchen or certified cooking place. Again, that the custom of people eating different things. Everybody is not into peanut butter and sandwich and grilled cheese or other things. Some of them like the Indian chapati or the Indian vegetable preparation. So that is something that perhaps some of the cooks in the hospital kitchens might be persuaded to really have a slightly different, without going into all the spices that are there in the Indian food. But some of the preparation could be make-believe, as close to what he at least is comfortable. Because ultimately, if he doesn't eat the food that you are preparing in the kitchen downstairs, then I think that we are really denying him the opportunity in terms of his recovery by not really attending to that facet of it, where he needs to have a healthy food, but also a food that he can relish or enjoy, or is okay with his health condition. All these really all go to only one area: basic information, basic understanding, and basic sense of sensitivity. The healthcare is no longer about, here is your Cipro medicine and here is your COVID vaccine, but it also has to do with treating the person as not a number as you come in, but treating him as a person who has perhaps special needs, concerns, sensitivities, and maybe in some cases serious challenges. And so we have to really, at the same time we are providing the health care, we also have to be like a family member who is understanding and is ready to look into, okay, it's not a number, it's a person, and the person has specific requirements or specific needs, and they need to be addressed, as Sajib said. They say if he wants to pray, maybe even the hospital bed, maybe he can sit in the chair that is part of the hospital room, but he prefers not to have any shoes at that time because he's in prayer, even sitting in the chair. So those are things that he's not trying to be difficult to you, but these are things that, as long as they don't interfere with the work of your healthcare and your medications and other things, that we can go a long way with regard to his recovery, and a faster recovery, if we are attending to that emotional part of it, the spiritual part of it, the cultural part of it, and the sensitivity part of it. Again, there is the whole issue of with regard to his, as Maninder just touched upon it briefly, and that is, if the patient were to die in the hospital, the families would really need to be part of that process of cleaning his body, bathing his body, preparing a new set of clothes or whatever, and he is to be cremated, not to be buried, but to be cremated. Now, if there is a crematorium in the hospital, there is something that he should be part of it, with regard to maybe they want to send him off with a certain amount of prayer, a last petition before God Almighty, even in the room where the crematorium might be, or that facility might be. And he may also really would be sent with all his sacred articles of faith intact. That is, whether it's a steel bracelet, or whether it's a kirpan, or whether it's a comb, that he will be sent forward with all those sacred articles of faith with him for their cremation. In our city here in Indianapolis, there are several funeral homes, and they have a crematorium as a part of their facility. And so once all the rituals and preparation of prayer and singing has ended, then the body is carried to the crematorium room, and there is a final ardas, final petition before God Almighty to take this soul and give him eternal rest. And generally, it is the elder son who would press the button of this electric crematorium with regard to sending this family member on its way to the higher level, to the spirit to join with the Spirit of God Himself. And so these are all areas, and you don't need to be all too much troubled by all this that I have now to learn about another faith. I think that some of these ideas and thoughts that we are discussing now could be provided on site by the family members, and could be by maybe a Sikh chaplain of some kind, or Sikh priest can be brought into the picture to assist with that. But it boils down, as I said, to only one word: that healthcare is no longer caring. Here is your medicine, and here is your vaccine, and you are well or you are not well. But it's about treating the person as an entity that has nerves and cells and muscles and memories and everything else, emotions and thoughts and traditions. And so they all need to be looked into and cared for. That doesn't mean you stop everything that you're doing. You simply seek help at that point to say, okay, there are 3 interpreters in my town of Kokomo or wherever you might be, and say, I might need your assistance to say a prayer for him. He's looking for somebody to read the sacred morning prayer. You can really have that resource already looked into, not once the patient comes, but as a part of your preparation for that kind of possibility, because there are lots of Sikh patients, as Maninder said, now, and some of them are in different ages, and some of them are in the elderly stage. So you're going to see more and more of them in the years ahead. I want to really have you ask the questions that you need to really want to be answered from by all 3 of us, or if there is a 4th person. And that way we would tell you what you need to know in terms of, like Maninder mentioned about abortion, unless other than in the case of the life of the mother is in danger. Abortion is not acceptable to the Sikh faith.
Uncle, can I ask? There was a question. Can you go over the difference between a baptized Sikh and a non-baptized Sikh, please?
Chajivi, are you asking me?
Yeah, someone.
Okay. Well, every Sikh has your poster that you had been advertising this class in, had all these people with long hair and turbans and all of that. All Sikhs in Indiana, all Sikhs across this nation, they all are not necessarily respecting, or not necessarily, in that mode where they honor all articles of faith. They still go to the Gurdwara, they still go to the place of worship, they still consider themselves as Sikhs, but they do not wear a turban, they do not have their hair uncut, shave off their beards, and so on. There are lots of those, but their requirements may be slightly less stringent than those who are baptized or who are following the tradition. And there are lots of those. So it's important to make that thought known to all 28 of you who are on the class right now. And that is, all Sikhs, even though ordained by their faith to have these sacred articles of faith, may not be wearing a Sikh kada, or may not be wearing a Sikh kirpan, or may not be having a turban or a beard. They need to be just treated the same amount of dignity by asking the question with regard to what his needs might be about diet, his needs might be with regard to the prayer in his room, or his needs might be with regard to whether a female doctor should treat a female patient, or a male doctor should treat a male patient. So his requirements may be still the same that is for a so-called traditional Sikh that you're looking at right now when you're looking at me and Maninder. But it's again, I happen to be a Sikh, and I think our ancestors have been Sikh for hundreds of years, but I am an advocate for all of you who are listening, and that is, this sensitivity is not to be just limited to the Sikhs. We're discussing about the Sikhs, and that's just wonderful, and I'm very proud of that. But this sensitivity needs to really go beyond the bedside manners to the cultural angle, to the spiritual angle, because that has to do with the holistic approach to a healing, a holistic approach to really getting better, holistic approach to saying, okay, I had a good experience in the hospital, or that I had a very difficult experience with because so and so a nurse or a doctor didn't care, shaved off my beard or shaved off because they wanted to do this without asking me or my family. You want to be in that place where you're accepting the patient as a human person with needs, with emotions, with the requirement, that needs to be honored in a respectful way. And I think that I can't emphasize that enough, because that is really is the key that has made the healthcare services so much more friendly and so much more, I think, acceptable, that I don't fear going to the hospital, because all of you are so kind when I go for any treatment or whatever. And that is the important feeling. It's half my heartbeat just gets into normal when I know I'm at a friendly place. And that is what really you want to say. Not that it's a friendship rally going on, but a sense of comfort is very, very important to your healing and to your spirit.
What is the process for baptizing?
Say it again, process for what?
For the baptism. What does that entail?
Yeah, Maninder, would you please address that, because you are a baptized Sikh, so would you please talk about that, the process of baptismal ceremonies?
Basically, I will just summarize, as you've seen in Christianity, how the baptism is done in the church. Same way we have a baptism done in our place of worship, which is called Gurudwara. So to be baptized, we must follow the followings, again, which we came to the 5Ks. As Mr. KP Singh and Chiji mentioned earlier, that all Sikhs are not baptized. That doesn't mean that we treat them differently, but they are Sikhs. So baptism will include all the symbols, which is the 5Ks. That is starting with the uncut hair, the wooden comb, steel bracelet, a short sword, and the long undergarment. Time and again, we talked about that. So basically, who's following the path of the Almighty Lord, that intact with the Sikhism? Sikhism started in 1469 by Guru Nanak. And the 10th master, which is Guru Gobind Singh, he initiated the baptized Khalsa, which is called Khalsa, the initiated Sikhs. So that's, as again, don't want to go into too much detail, just to make sure if you are going to run into a baptized Sikh, he will certainly have those 5Ks visible. And their protocol would be for the dietary supplement, for their diet, for their prayers, and for their hairs. All those needs to be monitored very carefully. So I hope I covered what is the difference between the baptized Sikh and the Sikh. Or Chijiv can add more to it.
We got a question. Can you hear me? Yeah. We got a question that, is it a sign of respect to address a Sikh by their first and middle name, Singh for males and Kaur for females? I was not able to give you the exact, more information, but after the baptism, all males were given the name Singh, which means a lion, and all females were given the last name as Kaur, Kaur, which means a princess or a lioness. And that's that all men and women are equal, and there is no gender inequality in Sikhism. coming to US or going to a different country, there were issues with the married couples, with the male and or the last names being different. So you will find individuals who have kept Singh and Kaur as their middle name, and their last name is their surname or the last name as we have here in US as Smith or Wood, or so they will have names like Maninder Singh Walia. Walia is his last name, and he has used, although he's baptized as Singh is the middle name. And similarly with me, my Shirjeet Kaur, I use Kaur as my middle name, and my family name or my married name is Oberoi, so I use that as my last name. So, and there is no harm in calling them with their, like Mr. Singh or Miss Kaur, or with their last names or their surnames as well. Does that answer your question?
That's great. That's a great explanation.
Just like here, can you hear me?
Yep.
Okay, just like here, we have over the years, you know, as Surjeet just tried to explain, added names after the word Singh and Kaur, and Surjeet tried to really put a beautiful perspective on that as well. The last names beyond the word Singh came as a result of their being in a particular profession, or there being a particular person of a particular quality, a particular town or city or occupation. For example, if I lived in the city of Lagooty, Indiana, I don't know if many of you know about Lagooty, but I like the name Lagooty, Indiana, then my name would be, because there may be so many KP Singhs, because everybody has the last name Singh that is ordained by the 10th Guru. And so they felt that it is important to really think beyond that and say, oh, Lagooty, Indiana, KP Singh of Lagooty, KP Singh of Lagooty, or KP Singh the architect, or whatever. But over the generations, then we dropped the word of, so he became KP Singh Lagooty, or KP Singh the architect, rather than KP Singh, just simply KP Singh. And so this is how Walias are a special clan that was a very, very prestigious and outstanding clan. They actually were Ahluwalias. And so Walia, also the word Alia means, somebody who is the caretaker, or who is the guard, or who is the person umbrella over things. And so, in other words, the names still, the ordained call for a Sikh is to have the name Singh and Kaur, but you may encounter other additional names after the word Kaur or after the word Singh that define the town, city, occupation, or whatever the characteristic might be that is chosen by the family. Somebody has chosen the name, so-and-so Anmol, Pritam Singh Anmol. Anmol means rare. Anmol means, so somebody gave a child name. And the reason this is important is that at the time of birth, the tradition says that you will not give him name immediately at the hospital. You may still want to really have a nickname of some kind, Sunny or Princess or whatever, depending on the gender. And the name giving ceremony then is given, or used to be given for centuries, in the Sikh temple itself, where you would go and take the child for the first time to the Sikh temple, place of worship, and the family would gather, and the name would be given at that time, and it will be actually from whatever is the hymn, sacred hymn, that is recited by the priest that day. At the end of the service, the first letter of the first word of that hymn would be the letter that you will choose to give the name to your child. In the case of Churjeev, you're talking to Churjeev, my big, beautiful sister here, maybe the letter C came. And so they chose different things, and the family agreed Churjeev sounds like a great name because the last name is already chosen, Kaur. And so the name is given several weeks later than the actual birth of the child, and not in the first 48 hours before the woman is released from the hospital. So this is something like an important information, or like interesting information for the caregivers to at least know about it.
Yeah, I can add to it. When my kids were born, they were born at St. Vincent Hospital, and we were asked to give the name within the 3 days. So when we explained to them, like we would be naming them with the religious way we do it for every child, they gave us 30 days. So they just put the mother's and father's name on the birth certificate, and they gave us a form. I believe you are aware of it. And they asked us, once the name is finalized, then send it to the hospital, back to the hospital. I believe it was Marion County where we had mailed it. And within a few days, we were given the birth certificate. So yes, we really appreciated their understanding our naming the whole thing and the whole process. We had to explain it to them how it goes. So there's a question from someone, KP Uncle and Maninder Viji, maybe you would like to take that. The sacred instruments, and I believe they are trying to say the articles of faith, are understood, but most hospital policies allow nothing that can be identified as weapons in the hospital. I believe they're referring to the kirpan, which is the small sword. Can these be left safely with security department or given to a family member?
I think that the simplest answer I would like to give is that when we are traveling on airlines, and you're carrying a certain level of kirpan, you have to really announce it, and you have to tell it to the captain, or you have to tell it to the authorities, and they would probably take possession of it and give you at the other end. Same thing applies here with regard to the safety of the patient and safety of the people that are going to serve this patient, safety of the doctors, nurses, and physicians and caregivers. And so it is not unreasonable to talk to the family member that brings this patient that we need to take possession of anything that can be used to hurt yourself or hurt somebody else, because this is the policy of the hospital. And so the nurse and maybe if there is a chaplain could take possession of that, of the duration which the patient might be in the hospital, and keep it in a safe place, and then return it to the patient at the end of end of his stay in the hospital. I think it's a reasonable request on the part of the hospital to say, we want you to be safe, and we want you to be safe, and we want others to be safe, and not feel that this small knife or kirpan in this case could really become an instrument of hurting yourself or hurting somebody else. This is what I believe that they would do for anything. Even if you go for a simple test at Community North here, they will take possession of anything, including maybe the stainless steel bracelet. They want it off so that nothing could hurt yourself or interfere with the very sensitive electronic equipments that are out there in the hospital that could be thrown off with a metal or with a cell phone or with any kind of thing. So I think that those are simple things that can be handled by talking to the family members, and also maybe explaining it to, and they can explain it to the patient that no, you cannot carry this kirpan now during the time you're in the hospital, but it's safely kept in a place under lock and key. Maybe could be in the same room, but under lock and key.
Can I add something to it?
Please.
I have been in the situation where a person was quite adamant about it. So we had to explain it to them that while he was going for surgery, that kirpan was kept in the safe, but just please make sure that that kirpan, since it's a very respectful, like that's the article of faith. It's not kept in with his clothes and shoes. Similarly, with the turban, when they undress and they take the turban out, that shouldn't be kept with the shoes of the patient. Since it's respected, if it can be put in a separate bag, that will be appreciated by the patient. And once the patient was moved in the room after the surgery, he was given all his belongings and he was allowed to keep the small kirpan. Since he was a baptized Sikh, he kept it under his pillow, if that's acceptable by the hospital.
And all you friends that are listening, I mean, in some instances, we have seen that a patient is quite satisfied that he doesn't need to have a kirpan as a separate item, but it is attached to the comb itself, maybe 1 centimeter long, that is stapled into it. And so something like that could really be all right. So he has symbolically what his article of faith need to be. But the 3-inch or 4-inch kirpan, that I think is a legitimate call on the part of the hospital not to have a patient have it on person. So I think those issues can be resolved by information, communication, and a respectful understanding on both sides without any problem.
Does that answer your question, Donald?
Yes, it does. Good answers. Thank you.
All right, thank you. The other question is that what should be done to support a patient spiritually if he or she is at the end of life and family is not present?
Well, if family is not present, then I think a lot of times, the doctors, nurses, they are very kind. The chaplains in these hospitals are very kind. So they are part of a substitute family. But it may be very helpful at that point if you feel that that is where he's heading toward hospice, or he's heading towards the end of life in some way, to reach out to somebody in the community, reach out to somebody who speaks Punjabi, reach out to somebody who can recite for him. Because one of his greatest love and greatest, I think, expectation at that time would be, oh, would somebody read me passages from the Holy Scriptures, which is in the form of a pocket. I mean, I call this, these are like pocket sections of pocket sections of the sacred holy book of the Sikhs, but also designated prayers. And so it would be very helpful if somebody can recite as he is on his way, or he's deadly sick or very sick, to really have that opportunity to hear the word of comfort and hear the word of reunion with the Almighty Soul. That those are very important to him. That is his life breath, so to speak, a spiritual breath, so to speak. And so he should not be denied that. I think an arrangement can be made in most cities wherever the Sikhs are. We have a patient here. He doesn't speak English. He does not read, he cannot even himself read it. But would somebody come in, or he cannot see and so cannot read it, that would somebody come in and recite the Sikh prayers for him? That would be very, very important, because some of the prayers at the end of life, they have passages that I think you would understand. Like in the sacred Bible, we say, in my Father's house, there are many mansions. That Christ says that he has prepared a mansion for each of you. So in the Sikh faith also, there is the same kind of reference. And that is that instead of the soul coming back over and over and over in the transmigration cycle, that if God would be merciful and would deliver this soul forever to be in the celestial region, or to the heavenly region, or to at the lotus feet of the wonderful Lord upstairs in heaven forever, and no more cycles of births and deaths. And so some of the hymns deal with that, to giving that kind of assurance. O Almighty, bless me this blessing this time, that all my cycles of life and death end, and I am eternally your servant at your court in the mighty heavens. So some of those prayers are very important to him to hear those, so that his cycle of lives and births and comings and goings and rebirths ends, and he's eternally given that blessing. So going with that thought before he leaves this earth, I think may be very, very important to each Sikh, but certainly to somebody who is in that condition right now, who is going to be leaving soon. And so in that sense, I think that is a very important question, that not only we give him comfort and blessing as a child is born, but throughout the life, and then certainly at the end of his life, that kind of comfort, blessing, and helping hand and spiritual hand, you can call it a spiritual hand, will be very critical to provide to this person with regard to, okay, don't be afraid, God has called you, and you are going to the house of God to live eternally there, to be present there. And so those hymns then deal with that area. And also you can at that point ask him what his wishes might be with regard to a special prayer, special reading of the entire Holy Scriptures, or giving special help to the Wheeler Mission or some other worthy cause he might have in mind. So it will be important to learn about that as well, that what his wishes, hopes, and prayers are at that time, since there is no relative there for him, and because the message then can be passed on through this intermediary, whoever that might be, who can come and bless him with the reading, bless him with the comfort, blessing him, maybe hold his hand, and bless him in that way as he's leaving this earth for his long journey up.
Certainly, I'd like to add just a couple thoughts to this main point here. That, as a belonging to the different congregations here in metropolitan area, that we can certainly prepare a list of the worship places that if the family is not present, that list can be provided to the respected hospitals wherever the caregivers are. You can certainly call those numbers, and the priest or a helper or chaplain from the very congregation can be provided that time to do a final prayer or sing a hymn, as Mr. KP Singh mentioned earlier. So we have to, as our part, we will certainly like to create a list of the different congregations that all the hospitals can certainly get to those very congregations, and they can provide the help while their families are not there.
And adding to what Maninder just said, it is important to, at least for my 27 friends that are on this class right now, to know that in the Sikh tradition, it is not necessarily important that we always reach out to the priest. Maninder can do that job. I can do that job to recite. Somebody else, Charjeev, can do that job of reciting. In other words, there's no gender problem with regard to being a good, intermediary for reading or comfort or comforting or whatever. Nor is there any challenge with regard to a female priest or a male priest. In other words, the Sikh tradition has abandoned all those differences that might exist in some other faiths, that anyone can at that point be a priest for the moment, be a chaplain for the moment, be a friend for the moment at that point, to give the guidance to this person with regard to provide the last readings, not last rites necessarily, but the last reading to this person. And a younger person, a child, can do that if he reads Punjabi and so on. In other words, that is not to be limited to, and that is where Maninder's call or his thought that in the metropolitan area there are maybe 2,000, 3,000 Sikhs here, and there are 8 or 9 designated Sikh temple. And so not only those priests might be available, but somebody from the congregation might be available in some cases to assist in that. And that would be true in Kokomo. That would be true in perhaps Evansville, Fort Wayne, Bloomington, IU, whatever, wherever your hospitals and facilities are. That there are physicians all throughout There are Sikh physicians now, several in the state. So besides them, that as far as the ritual part of is concerned, reading part of is concerned, recitation part of is concerned, in the Sikh tradition, it is not an option. It is a very important part of their daily life to have the reading, in the morning, to have the last prayer at night. And so in that sense, maybe somebody could come in for the morning reading or the evening rasa, the evening prayer, and provide this person the additional comfort, part of the holistic body, mind, and spirit. And Sikh faith is really kind of, in a way, very clear on this thought. And that is God Almighty is the healer of body, mind, and spirit. Tine tap nivaranahara dukhanta sukhras. He is the person who is concerned with body, mind, and spirit because they are intertwined, and the healing of a person requires all three of them in that equilibrium of some sort, in the same frequency, if you wish, that can help this person heal quickly. And so that means throughout the life, for the help and happiness of this person, for the joy of this person, for the feeling good about life itself, he needs to really have that prayer a part of his life as he may be leaving. And so that is something that I think, as I said earlier too, and that is something that not only the community can provide, but could be on your docket with regard to, this is part of the checklist. Does he know somebody or does he not know somebody? And if he doesn't, is there a person we can tap in the community that can come in and provide that additional counsel, a reading, a recitation, or maybe grab his hand and give him the comfort he might need at that point.
Very good. Just to I'm going to add another line to it, especially when there's a funeral, and hospitals do intend to tell the family that you arrange quickly the cremation places. So we have prepared a list for the few funeral homes that we deal with them on the regular basis. So that list can be provided also if there is no family member, or certainly they need to, especially the funeral homes also need to, we are working with them that they understand our tradition. When there's a cremation, what is the protocol? But certainly when we prepare a list for the congregations, for if there's no family members, nothing, we will certainly put the funeral homes names also in that list. That way, if a hospital has to contact those funeral homes on the behalf of the deceased family or deceased person, that they can get to them easily. So we are, as we are going along, we are still working on those with those funeral homes, that we get our, they get to know our traditions, what are the final last minute rites, what are our traditions. So that is ongoing, and certainly this will add to that discussion too.
That's wonderful. I'll definitely be reaching out for you for some of that information. Another question that I thought of was, earlier it was mentioned the concept of a certified kitchen. What does that entail, and what special requirements are there to be a certified kitchen for our patient?
Well, I think there is a little bit of a condition of the health department of the state as such, that the kitchen from which a food is prepared is already recognized. I was referring to that rather than me bringing something from home, which is not a certified kitchen. To me, it is sacred and certified. But for the hospital to accept that food, it needs to be from a place that you approve of, that is on your approval list. That if it is say India Palace, or if it is a Shalimar out there in Broad Ripple, for example, if some of you are from Indianapolis, that's inspected and that's approved kitchen and approved restaurant. And so, in other words, that is something that may be important to kind of look into it, that how stringent that idea need to be, because you do not want a patient to have food from home which is not checked out, which is not according to the specifications, and then the patient had a downturn in his health after all the medications you have given him, and he was well on his way to recovery. I am thinking about that as an additional protection. If the food has to come from outside, it should come from a place, a place and a kitchen that you feel is hygienically and health approved, health community approved hospital, hotel or restaurant or kitchen that would not jeopardize the patient further. That would really be satisfying on one side, that his need to have a food that's familiar with, but on the other side, we also need to be aware of it, that we don't want to have him have food that is coming from a place that you know nothing about and may not be prepared in the way that it needs to be prepared with regard to, your kitchens at the hospitals are certified in the strictest sense of the term, that this is all the patient can have. This is how it will be prepared. It can be a big steak. It cannot be this. It cannot be that. But if you are looking for other facilities, it may be a word that Maninder could send out with regard to that. Do you have such a stringent facility in your kitchen at Shalimar or whatever the name of the might be that can prepare food for a patient? We can check that out a little bit at our end and say, okay, along with the list of funeral homes, we can provide that this is the kind of place it's okay to have food, not for the family members, but for the patient, when he is in a position to have food that's a little bit more flexible than prepared in your own kitchen in the hospital itself. But that's a determination only the dietitian can make, that's a physician can make, and the nurses can make, and the caregivers can make, whether any food should be coming for the patient to the hospital for this patient.
Perfect.
I was going to ask you, I believe I've heard this, I haven't personally dealt with, but I have been told that IU has prepared Indian meal for the patients. Is that right?
I'm not sure. We have about 27 different facilities, so some facilities might have differences. I don't specifically know myself. I don't know if anybody else.
Well, it would be nice if they have an Indian menu to choose from. Then the certified kitchen will not be an issue.
Yeah. There was another question. Is there a cultural preference to have a male child over a female child at birth? If not, would you say that your culture celebrates gender equality?
Well, traditionally, Chirji, you want to take that? You have a beautiful son and a beautiful daughter. You want to take that question?
Well, I will go with the religion first. As per our religion, as per the Sikh faith, male and female children are equal, and I have celebrated both my son and daughter the same way. I've given them the same amount of education, but culturally, I would say, and there is, and it again depends upon which area the family is coming from. I have heard of some of the places where they would prefer a male child, and that is because of the system of, I shouldn't say dowry, because although we say it is not there anymore, but in some places you will still see during wedding season, the female child is given dowry, and for other reasons, some families will prefer male child, but that's their cultural thing. I'm blessed to have both a son and a daughter, and our Sikh faith says male and female child are equal. There's gender equality. What males can do, females can do as well. So it again depends upon what the family background is. Do you guys want to add more?
Yeah, just to add that thought for all my friends that are in the class, that there was a challenge at the time of the Sikh teachers in the 15th and the 16th century, and since then too as well, that there was the whole cases of where families had challenges with infanticide and other things with regard to really always having a male child, and female children sometimes got victim of that ritual or that problem. Sikh faith struck very heavily on that thought, that absolutely no, that only a woman can give birth to a man, only a woman can give birth to a woman, only a woman can give birth to a king and a Christ and a saint and an ordinary person, and challenge that thought. A woman that gives birth to lords and princes and saviors, how can she be any inferior to any man? And so, as Chirjeev said, not only the gender in this case is equal and recognized, because the word Singh means a lion, but the word Kaur means a princess, not a second-class citizen that needs equal rights amendment of the United States Constitution. No, a woman is a princess. In other words, that the last line of that hymn says, without a woman, there won't be any other way of continuing the human race, because she's ordained by the Lord Almighty to be the person who is going to been given the assignment to give birth to generations. And therefore, the importance of women in that case is not only equal, but exalted, because the word Kaur has two meanings. One is a lioness, and the other meaning of the same word Kaur is a princess. So she's not only married to a lion, Singh means a lion, but she's a lioness and a princess. In other words, worthy of additional respect, because she is ordained by God to give birth to life. And so the only person above her is God himself, but he has assigned this job of giving birth to a woman. So there was always a challenge with regard to people wanting a male child to really help in the farm or be in the army or other reasons, or play baseball. But it is no longer as serious an issue as it once was with regard to the gender of the child. Culturally, emotionally, spiritually, it is just all getting a lot more acceptable to have either or both, in the case of Chirjeev, or all three boys or all three girls, whatever the case, my combination might be, that a child is a gift of God, and so worthy of our love and caring and respect, and cherishing that from the birth till the last day of his life, the last day of our life. So there used to be a time, okay, the son is going to take care of the elderly, but in this day and age, I think we have found out in America and other countries as well, in India included, that the daughters are the more sensitive caregivers to the elderly than the sons. The sons run away to America or whatever. And so it's I'm putting a little cultural thought, the cultural shift that has been occurring for some time on this whole issue of whether a male child or a female child. No, child is a gift of God, but whatever God blesses is all right.
Earlier, it was mentioned that it's important to remove the shoes during prayer. What about socks, or specifically the hospital, like slipper socks that we often put on patients, or the leg sleeves that we put on to prevent blood clots? Should those also be removed during prayers?
Unless Maninder or Chirjeev want to take it, I want to just say one thought about it. And I think ultimately it had to do with the cleanliness with which you enter the house, the sanctuary part of the temple. And so in most cases, in the case of Sikhs, if you go to the holiest shrine of the Sikh faith, and this is now true of every other place as well. Here is the meet the holiest shrine of the Sikh faith. This is the Golden Temple at Amritsar, which is the St. Peter and Vatican of the Sikhs, where 100,000 people partake daily, free food every single day, and just before COVID came through. the tradition was that not only, and it's now being universally accepted and being implemented, that not only you wash your hands as you walk into the temple, into the Gurdwara, after you've taken your shoes off, you generally take your shoes off, and there is a place to immerse your feet in water, flowing water, to even cleanse it, clean it further before you enter the sanctuary area. So I think that the soft shoes or little shoes that they give you as a patient won't do. I think it's some people do walk into that with their socks, but the preference would be that you take even those soft shoes off, because I think that they will be still considered shoes with whatever it has picked up on the surface or whatever. And so the ideal part, maybe Maninder can add to this, would be that no shoes of any kind whatsoever.
Yeah, no, shoes are never allowed, especially in the places of worship. But when we are talking about a special place in the hospital where the prayer rooms are built, certainly, if the hospitals have provided those long socks, I don't really see any problem with that, because there's not holy scriptures are there, or that's just for the safety also, because that room is not going to be dedicated only for the Sikh patients. There may be other cultures there, other ethnicity or other groups might be praying there. So wearing a socks in the hospital area, wherever the dedicated place is, there should not be any problem. Yes, for the worship places, and that comes to the cleanliness of your feet, and then shoes and socks are not allowed.
One other quick thought is that for the shoes, of course, they're not allowed in the prayer room. But if they are sitting in their rooms, they can wear the clean socks. And one other thing which I would like to mention is that not all the people, all Sikh males and females, will be having a turban with them, so there should be something to cover their hair for the prayers when cover their head when they are saying their prayers.
Very good.
Thank you for that. What are some special holidays or celebrations that are important to the Sikh culture?
Well, there are several. We had, instead of one supreme guru or teacher or prophet, we had 10 in succession from 1469 to 1708. And so there are lots of holidays then in the Sikh tradition associated with their birth, their deaths, and when they became the guru, when they were chosen to lead the Sikh community spiritually. That was chosen, after a certain level of spiritual maturity and divine blessing, that they were chosen. And so they are associated with when they were elevated to the level of being the next guru or next prophet or next spiritual teacher to lead the Sikh community. So there are days associated with that. Then there are days associated culturally with when the crop is ready to be cut in April. So there are days associated with that, along with some other events that took place in the history of the Sikhs. And so if I can name just a couple, just for the audience, for the friends, there is the associated with the birth of the founder. That is associated, generally falls in the month of November, on the full moon night, and the actual birth is in April, like Christ's birth in April, but they have been celebrating for centuries in November, his birthday. Then there is the celebration that takes place on 13th of April, which is the beginning of the new month at that point, and also associated when Sikhs became Singhs. And so there is a major religious holiday and a cultural celebration as well, with the dancing, singing, and all the hoopla that goes with those celebrations. Then there is the whole festival of Diwali, Festival of Lights, that takes place sometime in late October, maybe early mid-November, anytime in that, because they are according to the Indian calendar, not the Western calendar. And that has to do with two things. One, it is associated with a historical event that took place in the Hindu community. But then there is a very special area that is connected to the Sikh community. That is when one of the Sikh gurus, the sixth in this case, he came into Amritsar after being imprisoned by the Mughal rulers of that time and was released, and he arrived at the holy shrine of the Sikh faith. And so there was a major celebration. And that day happened to coincide with Diwali itself, the festival of Diwali, festival of lights. And in between, there can be, birth celebrations, and just like we have here, marriage anniversaries and so on. So Sikhs indulge in a lot of fun throughout the year in whatever form and shape that they can. They are a very optimistic and positive kind of a community with regard to they are recommended. Don't be a morose person. Don't be a person with negativity. Don't be a person with down face and down and out. They are recommended, they are prayed for, and the parents will give you this blessing. Always be in Chardi Kala. Chardi Kala means a spirit of optimism, spirit of positive exuberance. And so a lot of festivities take place in people's homes and communities and guest rooms and guest houses and hotel rooms that are connected with marriages and anniversaries and birthdays and all of that. But the major activities of the Sikh faith festivals are connected with the birth of the first founder, big important, birth of the last founder, the 10th Guru, and then the conversion of the Sikhs from Sikhs to Singhs, or the transformation, I should say, not conversion. That is Baisakhi. That is a very important, comes about the second weekend in April. And then Diwali sometime in November, which is the Festival of Lights. So those are the major holidays. And some patients might like to know what is the major event taking place at the Sikh temple. And those lists can be also provided to the hotel personnel, in this case, Anne Cottingham, or maybe Rebecca Tierney. We can provide her that these are the major holidays this year for the Sikh community. In other words, we can go to whatever level of depth you might need in terms of what you would like to know or what you'd like to assist your patients with regard to the Sikh patient or other patients of other faiths. This is all very helpful to a patient, but some of it could be really part of the responsibility of the family or the priest who may come in to look at the patient. Because you have enough to do with taking care of the patient, and we understand that. But yes, that's a very important question, and it will lift his spirit. Oh my God, today is the birthday of the founder of the Sikh faith. Today is the full moon night and associated with the ascension of the sixth Guru from an ordinary person to the next level of leading the whole community. So that can be very helpful in that case, but that can be given that job assignment to you. So, you need to memorize all the Sikh holidays and all of that. I want to add, before it is connected with this thought, that all of you who are listening and all of you who are going to be seeing this video, on behalf of Maninder, myself, and Chirjeev, and all the other leadership at the Sikh Satsang, you are all invited to come. And the COVID is over, when this whole challenge of COVID and all that, the restrictions are over, come and visit us at the Sikh Satsang of Indianapolis, which is the largest Sikh congregation in the state, the oldest congregation. Come and visit with us, have a vegetarian lunch at the end of the service with us, and let's really have a hands-on experience of what a worship looks like, what the Sikh people look like. And maybe we could call the leader among you to really say a few words. If Maninder would give me permission to, I'm going ahead and extending this invitation to speak to the whole audience there and tell them that how you are trying to be as helpful to the Sikh patients as you have been to the other patients, and come and join us for an added education and added introduction to the Sikh faith and community.
That is so generous of you. I cannot wait for COVID to be over, because I will definitely be taking you up on that offer.
We want you to, and we are going to put you on our email list. Maninder, please put Rebecca and Cottingham and anybody else on your list to really keep them posted about things happening at the Gurdwara.
Thank you for that. Earlier, you also mentioned the sacred underwear that is worn by, I missed whether it was by both males and females or one versus the other. Can you also go into depth a little bit more about that and how we should treat that as care providers? It's pretty typical, as I'm sure you know, for us to switch everybody to hospital gowns the minute that they come in and kind of remove everything. So how should we respond differently with the sacred underwear?
Chirjeev, are you there, Chirjeev?
Yes, I am.
Go ahead and answer this question.
I'm sorry, can you repeat the question? I was responding to your chat.
Underwear, and how should they treat the underwear for male or female patients at the hospital? The Sikh underwear, not the Hanes cut, but the old kachera.
Well, if we are talking about the baptized Sikhs, they would certainly want their own underwear. But there again, it's like it depends upon where the individual is in that spectrum of beliefs. So you may want to talk to the individual and see if they would allow you to be provided what the hospital generally provides it to them. But culturally, I would like to add one important thing, which when I was an interpreter, I found that one important thing is that the females would be more comfortable being treated by a female medical provider or a doctor or nurse. And similarly with the males, they are more comfortable with the male providers. In regards to the undressing too, since we are talking about the undergarments, all the patients, including males and females, and that's my personal observation, it may be different, that they would generally want like a private room and help again with the same gender. So I have seen females being very uncomfortable with the male nurse in the room, and when they were asked to change into the gown. So those things have to be taken care of.
Thank you very much. That's very helpful as well.
Sure.
Can a person become a Sikh by baptism if they are wanting to follow the values and principles of the faith? What is required to do this?
The simple answer to that question would be that, well, let's start with this thought. And the word Sikh itself means a disciple, a student, an eternal learner. So it comes from the Sanskrit word Sikhya, which means to learn. And so in other words, that anyone, including the people that are listening, I mean, they are all shish. Shish means disciple. Shish means student. And they are student. They are part of your class here. And but anybody can be a Sikh. There is no restriction about somebody being a Sikh. There are 100,000 American Sikhs that live in near Tucson, in the Espanola area up there, and they have followings of other Sikhs all over the world. Actually, they have been going about into South America, and there are maybe pockets of Sikhs throughout many countries in the southern hemisphere as well. But it is not really mandated that you had to convert, because Sikh faith has not been traditionally a missionary faith that tries to convert others to do that. But those 100,000 Sikhs, American Sikhs that I mentioned, they have jobs, they are doctors, they are lawyers, they are engineers, they do everything else, but they follow the tradition of the Sikh faith, in some cases far more strictly than most of us who were born with that faith. And many of them are very learned. They have brought the Sikh faith into the world stage in so many ways, with art and music and interpretations and reading and research. And so anybody can be a Sikh if that's what they wish. But again, Sikh is really, in other words, other than the turban, beard, and rituals, I mean, we are all Sikhs. We are all learners. We are all students. So as such, we can all be people who want to learn about other faiths, cultures, and communities, because we are going to end up serving them. And we are going to end up really having some connection with them. And so, but if anybody wants to convert to the Sikh faith or follow the Sikh faith in a formal sense, I'm sure there are things that Maninder can talk about with regard to that. That is not a complicated thing in terms of, oh, you are a Christian and so you cannot really accept this. No, people from many faiths have accepted Sikh faith in the last 50 years that I know of. And so it's an open-ended faith with regard to, but no major missionary work to force people to do this or to you will be saved because you're a Sikh. Sikh faith rejects that concept that you'll be saved if you're a Sikh. Sikh faith says, when you go from here, and this is not related to your class, your healthcare class, but related to the spiritual end of things, and that is nobody's going to ask you what tribe are you from or what faiths you followed. They are going to simply ask you, so what offerings and gifts you have brought with you in this cycle of life. In other words, serving is an important part of the Sikh tradition. It's a major pillar of the Sikh faith. So in other words, that is really where the Sikh faith is with regard to those who serve. They are blessed, whether you serve in this capacity or that capacity. And what you're doing as a healthcare professional, that is one of the highest form of service to save lives and to put lives back together and to heal people and send them home to further really contribute to life, liberty, and pursuit of happiness. So, but I'm giving you a very general answer with regard to whether you can be a Sikh. Of course, you can be a Sikh if that's what you prefer.
Wonderful. Can a Sikh marry outside of his or her faith or culture, and are there restrictions?
I think it's a good question for Chajeev. She can answer better than I do. So, Chajeev, you go ahead, please.
I will be short here. Yes, it's acceptable. Acceptable to marry outside of your religion, but the restriction is if this marriage or this, we call it unencouraged, it will take place in the Sikh temple unless that other person has accepted the faith. Am I right?
Yeah, again, while we have come from the different shores of the world, and it will become an individual responsibility. Even the adult Sikhs, young men or young female, male, it's their choice. It has come to that point. It's their choice that how they want to choose their life partner. But certainly, I'd say the marriages are happening. So certainly I don't see any restrictions there, or they're following their family traditions, the family background. There's so many other things depend on answering this question. So, but when it comes to a individual adults, this is their choice. I'm sure that there are very few cases do happen, but they are happening.
Yeah, the other dimension to that, Rebecca, would be that in case a Sikh lady marries a Jewish person, sometimes there are two different ceremonies that take place, one with the Sikh tradition and one with the Jewish tradition to satisfy both ends of things. If there is a Christian and a Sikh, then there will be exactly the same kind of thing, that part of the marriage, one marriage ceremony would be in a church and the other ceremony would be in a Sikh temple. And so we are seeing that, as Maninder just pointed out, that adults are really free in this country in the present century, present decades, in recent decades. to choose their life partners, not like it used to be where family designated a certain person to marry another, someone that they knew within family units and all of that, where they knew the family, and so marriages were arranged rather than spontaneous or selected by either partner. But in this country, it's a free country. They go to colleges, they go to school, they learn here, they learn about what is the culture here. And so we are seeing, Maninder was being modest, but we are seeing several, we are in the past 50 years, we have seen many of the young persons on both sides, both genders, marry somebody from outside their faith. And so then what they do beyond that, with regard to how they raise their children or how they don't raise their children or what particular faith the children might be and all of that, that's again is a further down the road type of decision that the adults might, as adult children, they might have to make. But that is certainly, as Maninder said, the word happening is good. That is happening. And I think other than maybe in some very unique and individual circumstances, the community is not really interfering with that. Maybe a particular family might, because they're so orthodox or whatever. But generally that the community doesn't interfere with that, and neither do the families. And in many cases, they are accepting of things as they're evolving. And we are the second generation here, and so we are still evolving as to where we are heading.
Wonderful. Who is seen as the primary caregiver and decision maker of the family?
Well, in my family, Maninder is my caregiver because I chose him as my son. He refused to be my son, but I said, no, you're going to take care of your father. You're going to call me father. You're going to take care of me. And then I have two boys who take care of me here, who know something about technology, and that's why I'm talking to you guys. The caregiver, I think in most homes where both family members are working, it's an equal opportunity for both members of the family to be caregivers. Unlike India, where there was joint family and the caregivers were generally elderly people in the house or the mother in the house because the father worked. But here in the Western society, I think everybody has the responsibility to be part of the caregiving army, caregiving staff in the house. Sometimes the children are the caregivers because of their upbringing here, or they're bringing that knowledge here to the home. But either parent can be a caregiver. Traditionally, it used to be, okay, the job of the father is to be the bread earner, and the caregiver was always the mother of the house. That is no longer necessarily is a model that happens in my house. Everybody has to be a partner in giving care to each other and to the children.
I will also add a line to it that certainly this question leads to the legal aspect of the question, that who will be the caregiver in case the family have to make a decision. So those incidents do happen quite often. I've seen those. Usually whoever the head of the household is, they make the decision, and they consult the community leaders also, especially on the terminal illness, the last rites, and some folks have their wills are also made. So that certainly there are a few dimensions to this question. So family, it's better start from the family, finding out they have any wills or anything, who's the decision maker.
And from the health point of view, that's a very important question, that who would be the helper or caregiver or contact person for you when a patient is at the hospital. And so that is an important question. We all need to reflect on it. So in one house, it may be the mother of the house. In another place, it may be the son or the father of the house, or maybe even a grandparent or some other uncle and cousin and so on. But it's an important question. You asked a traditional question, and I think we try to refer to that, but Maninder has added a very important dimension to it, that the caregiver could vary depending on if there is a divorce, depending on if there is a challenge of they don't get along, or the burden is too great, and so somebody else has to step in, and so on.
Speaking of divorce, is that something that is relatively accepted?
Maninder?
Yes, yes, please. Yes, I mean, we have seen we have experienced this thing here. And again, I would use the same word, it's happening, and it's certainly every individual have the right to make their own decisions. And we have seen the divorces, and they are, to answer your question, yes, it's accepted by either party. So we have seen the divorces. So it's not that we are not aware of. This is, there are divorces that are happening in our community.
From a Sikh faith perspective, we are asked not to jump onto getting a divorce. Basically, work out your problems from the faith perspective. But like Maninder Viji mentioned, that this is happening, and there is lack of tolerance in
With the COVID.
couples now. Yeah. So they don't agree with each other. The roles have changed, and so we are seeing this as I should call it a new trend. But our faith asks us to work out our problems because, and not just lead to divorce or separation.
Yeah. Leading to the same question, your question could also get to that point that you may some cases come in with the domestic violence. There are injuries related to the issues. So there are a lot of domestic violence cases that are also happening.
Going back to the earlier thought that I think we were discussing, and I think all these areas that have been touched, I think they need further discussion, but I want to bring it to you. Indian patients, Sikh patients, are not accustomed to volunteering a whole lot of information. This hurts or that hurts, and they will not tell you how much it hurts on the scale of 0 to 20. And so you have to have some understanding about that with regard to, okay, so the patient is telling this, but took the mother aside, or took the brother aside, or took the priest aside and said, no, the problem is far bigger. In other words, that is a cultural thing to minimize the hurt, the pain, the anguish, the difficulty, the skipping heartbeats, or whatever the case might be. That you as a caregiver have to somehow figure out a way, to discern a way how you can get the information that you need to have the right treatment, to have the intensity of treatment or the medicine or medication, or make a program for the recovery. And so, we have doctors in India, you call them on the phone and they say, I have a stomach ache. And without seeing you, he will send you a prescription through either somebody in the family or to somebody that assists him right to the house without having looked at the pulse or heartbeat or urine test or anything of that sort. In other words, that they are Punjabis in particular, they also would really, as Maninder really brought in a very important point with regard to domestic violence, that they would not tell you how you got hurt. In other words, that there may be a case here where you have to probably be playing the role of a little bit of an investigator in terms of really finding the truth so that you can treat the patient adequately and properly and in the best possible way to know, okay, so what caused this gash? What caused this black eye? What caused this particular condition or situation? But that's no different than any other community. But in other communities, people sometimes really have a lot more to talk, a lot more to tell, or somebody's there to tell you. But in the Punjabi community, the wife may not tell you what happened to her or whatever, or the husband may not tell you how he got hurt or whatever. And so, in other words, that is an important dimension to treating a Sikh patient, to really find out a little bit more than what is on the surface.
That's an excellent point. I just got our 5-minute warning, so if there's any last-minute questions that anybody wants to type in, I want to thank you all so very much for joining us today, for taking the time out of your day to share so much valuable information about your culture, and I just cannot thank you guys enough for all of this.
Rebecca, as we close, I wanted to just thank you all on behalf of the Evans Center. I'm Lexi Torkey, I'm the director of the center, and I did want to invite Anne to talk a little bit. I know that early on there were a few comments about how much wonderful information is here and how it would be great to be able to have it synthesized. And I know that Anne is planning on that. And so if she's still available, I wonder if you could talk, Anne, a little bit about next steps and what you're already doing and plan to do with this project.
Thank you so much, Lexi. And again, thank you to our Sikh experts who have been here today to help us better understand how to provide respectful and appropriate care to Sikh patients and families. We so appreciate you joining us and you sharing this very important information. As Lexi shared, we will be recording these stored recordings on the Evans Center website. We are also reviewing the transcripts to pull the important information and put it in a very easy to access format so that clinicians across IU Health, across the state, will be able to quickly access important information about caring for Sikh patients and families through this method. This is part of a larger series of conversations that we are having with multiple faith and spiritual communities. Our first, you might remember, was caring for Jewish patients and families. We will have additional conversations coming up in March, caring for Muslim patients and families, and then look for following conversations that will be continuing through the rest of the year. So we really are focused on ensuring that communities that we partner with, communities that are so important to this hospital and to our broader community, have the opportunity to share ways that we can improve the care and focus and make relevant the care that we're doing so that all patients and families are appreciated and receive the kind of respectful care that they deserve. Lexi, do you have anything else you would like to add?
No, thank you so much. And we're just really excited that we'll be able to disseminate this information even more broadly to really improve our care of patients.
And I would also like to thank William Taylor and IU Health Chaplaincy, who's partnering with us in this work and putting together these very important conversations. So thank you, William, as well.
One last point I want to mention is that some of the things that Maninder so eloquently put together, he talked about it in length. They are already adopted guidelines in many places, including in the city of Chicago. They are called the Guidelines for Healthcare Providers Interacting with the Patients of the Sikh Religion and Their Families. So I have sent a copy of this whole text to Anne, and I hope that she can share that with students and other caregivers as well. We think that you are going maybe a mile further than what was adopted in 2000, year 2000, in terms of the care, and all three of us, Maninder, especially Maninder, because call him first, because he is our leader. And then his second in command is Sirjeev, and then I am just the cheerleader, and I'm really, backing them up, whatever they need. That do not hesitate to send any questions in writing that you feel that you missed a particular pronunciation or a word or a thought, or you need it elaborated. So please stay in touch, and we want the rules that you adapt and the healthcare guidelines you adapt for Indiana and through IU should be the best in the nation as a model. So we are here to serve, we are here to help, and we look forward to continuing to be of whatever support and assistance we can be.
Absolutely. Thank you so much for that. Just as a last minute reminder, if you guys did not send your text in for attendance, please do so. You shall receive a survey within the next couple of weeks. Make sure to complete that survey or you will not be able to get your CEU certificate. If you have any questions, please reach out to myself, William Taylor, or Ann. And we thank you all for your time today.
Thank you.
Thank you very much.